And we are all set.
Yeah, it looks like it's live now. Okay, so welcome to the Southborough Board of Health meeting on April 20th at 4:30 p.m. And I need to read our virtual meeting. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of open meeting law and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend the meeting can be found at Town of Southborough website. For this meeting, members of the public who wish to watch or participate in the meeting may do so the following manner: at virtual meetings, Southborough website, virtual meetings. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on Southborough's website an audio and visual recording, transcript, and other comprehensive record of proceedings as soon as possible after the meeting. So welcome.
Hello.
Hi, Taylor.
Hi.
Is Heather's going to join too, right? Is she
Yeah,
back
she's
in the
gonna-
office?
Yeah, she's hopping on right now.
Okay.
Now, do you want me to promote Kathy Cook now?
You know, she doesn't need to because she's probably busy doing work. So we'll get started and then pull her over when we have that discussion.
Okay.
I just wanted, did everybody get the budget that Barbara sent with this
Yes.
agenda?
I think I
Okay.
sent it to just, I think at the board and Heather. I wasn't sure if
Okay.
Taylor had her email up then.
Well, I
Yeah,
think
I didn't get it. But
Heather's
that's okay.
Heather's
get
in
what?
there with you. Heather's in the office with you. So
I'm
if-
right here.
Oh, perfect. So you can get that budget if you have any questions, Taylor.
Okay, thanks.
The focus of our meeting today, I know it was a quick, and thanks. I know Dan couldn't join because he's on vacation, and it was kind of a quick turnaround. But as you know, we've been trying to finalize our budget because the warrant needs to be published. And there's been a lot of conversation between advisory and Board of Selectmen, and I think we've worked really hard to try to meet the needs of everybody. And I know we voted on the budget that you actually see in front of you at our last Board of Health meeting.
Right.
But advisory asked us to reconsider Barbara being split because at our last meeting, we agreed to keep Barbara full-time on the Board of Health budget and keep the health director and the nurse position at the same as 21 because CARES Act would fill the difference, and advisory has voted to backstop those positions. So we have those full positions through the full fiscal year, which is awesome. And welcome, Taylor, on your first day.
Yeah,
Thank you.
welcome.
So we now know your contract goes till June. We'll go to June of 2022, which is awesome.
Great.
So I guess if Kathy is on, Barbara, maybe you can bring her. I know she wanted to speak to the issue of Barbara being split versus full-time in the Board of Health budget.
There she is.
Kathy, are you there?
Oh, she needs to unmute. Oh, there she goes.
I am now.
There she is. So welcome,
hi,
Kathy.
everyone.
I just sort of gave a little overview. You probably heard.
I did.
And the budget that I think everybody has is the last budget that was approved by the Board of Health, and we've
Can
met.
one of you after this email it to me just to make sure I've got the right one? I think I do, but just to be clear, so we don't vote on a bad.
Yeah, Barbara, can you send that to
Uh-huh.
Kathy? It was the one that went to the board members that has your notes on it.
Mhm.
Got it. Let me just look what I sent.
So it was a total budget, Kathy, of 234, 283.
Okay.
And that was taking into account that the health director was maintained at 19 hours. The public health nurse was maintained at 15 hours, same as 21, but we had to adjust for the new rates, new salary rates. And then it said Barbara with an increase to BA1 at 54,000. And we eliminated the temporary salaries because those were the public health nurses that are helping with COVID. And so we don't want them in the budget because we want to use CARES Act to reimburse for that. So that is pretty much what accounted for an elimination of the wireless phones. So that brought our budget down to 234, 281.
Okay, I got the number. So everybody, thank you for doing this real quick. The timing was tonight, everything's being finalized that's going to be included in the printed warrant. And so what the town is going to see on May 22nd is what is going to go to the printer in the next couple of days. You can change it at the town meeting. You can actually vote to reduce a budget. You can't overall increase the budget. You could take from one and pay for the other, but you've got to overall either reduce it or leave it alone. So you don't have total flexibility once you get to town meeting. Anyway, having said that, so what I've been talking to Mary Lou about the last few days is that advisory is asking you to leave Barbara at 24 hours in your budget so that she stays 16 in the assessor's budget using the new rate so that we can then ask for CARES money to basically reimburse the town for what Barbara spends on the Board of Health with the expectations that it's going to be very close to full time. So at the risk of repeating myself, I have talked to Paul Sabelli, who is the, so Taylor, I know you probably don't know these names yet, so welcome. But Paul Sabelli is the assessor who runs the assessor's office. He is well aware of what the Board of Health wants to do with Barbara. He understands the need. He, in fact, for fiscal year 21, I think, and Barbara, you can correct me if I'm wrong, is pretty much worked almost full time with Board of Health, at least since the pandemic started, which of course is this entire fiscal year. So he has said to me, point blank, Kathy, whatever they want is fine. Just try to get it done. I understand what you're trying to do as far as trying to get CARES Act money. So all we're trying to do is say, we acknowledge that Barbara's going to work very close to full time at the Board of Health. I have said to Paul that you want her to work at the Board of Health 9 to 5. You want her to sit down there so your office is open. He said, fine. We have started making arrangements to make sure Barbara has access to all of the software she needs on a new laptop from the Board of Health. So we're working on that too. So we've done everything we can to try to accommodate every one of your concerns. But if you leave Barbara in Board of Health 40 hours, we cannot get any CARES money that I know of to reimburse us. So that's what's at stake here. It's as simple as we're trying to get everything we can reimbursed as far as Barbara's salary goes, with the recognition that for the most part, she will be working for the Board of Health and she will be sitting at the Board of Health. So that's kind of my spiel. I don't know what else to add to it. Mary Lou knows all this. We've talked about it, so I'm not adding anything new to what she knows, but Nancy may not have heard all of this. So I'm trying to do this for Nancy's benefit.
Thank you. I appreciate it.
Okay.
So Nance, do you have any thoughts on, I know we talked about a little bit at the last meeting, but based on the current and trying to get a budget that we all support to go forward, do you have any thoughts on?
Well, I find it hard to believe they don't need her more at the assessor's office. There's so much buying and selling of real estate these
Oh my
days.
God,
But
has there been? Oh, yes.
So how has Barbara, how much have you worked for the Board of Assessors since July 1st? Do you have a rough idea?
No, I try to get up here twice a week in the afternoons. If he needs me at any other time, I can do that as well. But I've been a lot at the Board of Health, but I do try to get my jobs done here at the assessors.
So what would you estimate in any given week? It's too hard to narrow it down.
No, I still try to do 8 hours out of the 16.
Okay,
And some of it overlaps into Board of Health time. I mean, I'll print out building permits and stuff or whatever. I'll answer questions,
okay.
so I don't have to answer them all up here. So I do try to keep up.
I guess my concern is, you don't want us to have this huge increase in our budget, but yet how's it going to be next year when we don't have any CARES Act money? I don't really understand. You want us to do it incrementally. I don't know. I would like to see Barbara full-time with us, to be quite honest with you. I think there's more than enough for her to do.
We always try to do changes in budgets incrementally because we try to keep the overall increase to the taxes for our
Right.
residents at something that looks like inflation, right? Because there's a lot of people that live here that live on Social Security. They get a 1% raise every year. So we're trying really hard to keep, especially this year because of COVID, to keep the year-over-year increase down to something that looks to, I hope, most people as being at least reasonable. Right now, it's about 3.3%, just FYI. One of the people on the Board of Selectmen is pushing to get this even lower because she said, this is Ms. Braccio, she said that she's been called by several residents, and she told the story last year where someone actually came to her house just begging not to have their taxes go up, that they would not be able to put food on the table if they went up a penny. But we can't keep them down to zero, but we really do strive to try to provide the services at an increase that we hope that people can absorb. We started this year, just so you know, at almost 10% year over year, and we've gotten it down to 3 and above. So every little penny helps as far as I'm concerned goes. So you're right, Nancy, we do try to do things gradually, not with big
Right.
bumps. And next year, it's acknowledged that fiscal year 23 would have to absorb all of it because we don't know that we're going to have any CARES. We're assuming now we won't. If it gets extended, great. But if not, maybe we don't want it to be extended because that means maybe we don't need it to be extended because the
Right.
pandemic is in better shape. We really don't want this to go on and on, right? So next year is next year. We don't always take.
Well, you say next year's next year, but I feel like next year the pandemic will not be on people's minds as much, and the CARES Act money will be gone. And then we will be back to where we started with bare bones staffing and not able to do nearly what we would like to do and what is honestly expected of us.
I don't know that you should look at it that way. Fiscal year 23 is not even being discussed right now. So the idea that doing what we're proposing, which is try to leverage the CARES Act money, is going to put you in a box for fiscal year 23.
Mhm.
I don't think that's correct, but we're not there yet. So I don't know how we're going to look at fiscal year 23. I do think there's some things that are going to help us in fiscal year 23 we didn't have in fiscal year 22 that have nothing to do with the pandemic. So I don't know. I can't make any assurances for fiscal year 23. You guys control your own budget. You're a separate board.
Right.
You basically pass your own budget, and that's what gets printed in the warrant. And so then it's up to others at that meeting to say that they disagree with it. If they do, they won't
Right.
increase it. They could try to decrease it. So advisory's meeting at 6:30. That's why this was needed to be before 6:30, because
Yes.
we will then vote on what you approved today. So if you say we're going to stick with the number that Mary Lou just gave us, then that's what we'll vote on, yay or nay, as far as supporting. So all we're doing is voting to say in the warrant article, we're voting to either support or not support the overall budget. So it's not like we can say we support everything but
Right.
we've got to either say yay or nay. And I don't know what advisory, 7 people, I'm 1 person. So I don't know what we will vote. You've come a long way to doing what we've asked to do, no doubt about it. So this is the last ask. And so this is it. I do think that Barbara will get to do for Board of Health what you guys want her to, because I heard what Paul Sabelli said to me. He said, Kathy, just know that they'll get what they want to get. It's going to be, he kept saying, it's going to be fine. It's going to be fine. And Barbara, you know more about what you do for Paul than any of us. So you know him better than I do. I know him pretty well, but you know him even better. That's exactly what he said. And I'm not even adding a word to it. That's a quote from what he said. So.
Oh, I guess Kathy, my and Nancy, my concern is a little twofold. One, and Barbara, speak up if I'm speaking out of turn, but if you're responsible for 2 jobs, which as a split position, you are responsible, even though you're spending most of your time down there. There's some big influx of something, you've got to go up there. Your mind is split. You're not thinking about
Yeah.
Board of Health, what needs to get done? How do I organize it? I have a plan of what to do. And all of a sudden, okay, now I got to go 2 hours up there or sit down here. We have 3 major holes, which we're going to talk about in a little bit, where CARES Act can help us. And that is digitizing all of our records, looking at our privacy and security potential risks and what needs to be done about that, and communications. And Barbara's going to be a critical role in overseeing those 3
Mhm.
contracts if we're able to do that. And I just don't, I mean, we have 40 plus hours work, I feel, over the next year. And I'm not comfortable with her splitting it. And I think we've sort of worked together and got our budget from 309 down to 234. And so that's just where I stand. I don't know, Heather,
Yeah.
do you want to weigh in on your thoughts on all this?
I mean, if nothing else, Barbara's going up there 2 days a week, right? 2 afternoons a week, going up to assessor's office.
But what they're proposing, Heather, is that she stay in the Board of Health office, even when she needs to do assessor work. And that's all great, but your mind is shifting from 2 completely different jobs, and you got, then you answer a phone while you're doing assessor work and you've got to shift back. I just think we have so much on our plate over the next year to try to get our feet under us after all. Pandemic starts to wind down being our front and center. I'm
Mary Lou,
concerned.
can
about
we
that.
ask Barbara what she thinks? Barbara, we really haven't said, what do you think? Do you have an opinion, strong opinion one way or another, as far as what we're talking about?
No, I will go whatever the board wants. And if it means, we're still working for the assessors down there at times, once I get that computer, it'd be a lot easier, but considering I had to run home to get my own computer. But I want to do what the board wants.
Okay.
So
Okay.
I'm going to make a motion to revisit our budget. Nancy?
I
is-
second the motion.
Okay, and so we've already had some of that discussion. Is there any other discussion about revising our budget based on our last vote before we go to vote? Does anybody have any other
Nope.
discussion? Okay, so I make a motion to accept the budget as written, as we last voted.
I second the motion.
How do you,
And I
Nancy, how do you vote?
Well, you made another motion. I
Yeah,
think
the
you need to
motion
vote.
was-
Okay,
I made I made a vote. I want to vote to,
okay.
I vote to, do we accept the budget as it is, was last voted, or to revise it? So Nancy, do you vote to maintain it the way it is or to revise it to have Barbara split?
I vote to, yes, to keep it the way it is.
Okay.
I do not want Barbara to be split.
And this is Mary Lou, and I vote to keep it the way it is and keep Barbara full-time on the budget.
Okay, so 234,281, correct?
234,281, right,
And
Barbara?
Barbara, 54,000.
Yes.
54,000, that's with her increase and her cost of living increase too.
All right. Okay, ladies and Paul. Hello, Paul.
Hello.
All right, thank you, guys. We will take our vote tonight, and as will
Okay.
BOS, and we'll let you know.
All
Okay.
All right, thank you.
Thank you.
Okay, bye-bye.
Bye-bye.
Kathy?
Thanks, everybody. So, so the other thing that I wanted to talk about was accessing some of the CARES Act money for some of our critical needs right now. To me, it's an opportunity because COVID is sort of taking over a lot of our time. But yet there's CARES Act money to support some work that needs to get done. The three critical needs that I see are digitizing our paperwork, and look at possibly hiring a consultant to help us figure out how to do that. How do we scan these documents, organize these documents, and get a naming system that's going to work for everybody? Number two, communication, which we've all talked about, is, we need to have a better way to communicate with residents about what we're doing, how we're doing it, and in a format that we can update and have a process, a communication plan on how to do that. And I think having a communication consultant that works in public health, I've been in communication with Sam Wong a little bit. He has some, he's going to get back to us with some possible options. And then the third thing is our privacy and security. We have a new IT person that just started, but he's going to be very overwhelmed with everything going on, and maybe isn't a privacy and security expert.
Right.
And so if we can contract with someone to come in and actually support the work that he's doing, but do an analysis of the health department to see where our potential risks exist, and then what we can do to mitigate those. And I want to get your thoughts on that. I think the process, we'd have to go through an RFP, and I'm sure the technology committee would help us with selection, or get involved with that, or the new IT person. But I want to get your thoughts on those three things.
I think those are all great ideas and a great way to use some of the CARES Act money.
Heather,
Okay.
Paul, do you have, either of you have any thoughts on any other critical needs we might have that we could actually access CARES Act money for?
I think you've pretty much mentioned those critical needs. But communication is very, very important, and one of the things that we have not really put much attention to, and it's showing up now in a real glaring way, because of the fact that it's become very apparent that it's an area that we've neglected over the years, and anything that we can do to find out, how we can get the word out as to what we do on a more regular basis to the public would be very helpful. But you're right, how we do that, it's one of the things that a lot of boards of health don't have really a handle on, because it's sort of a neglected board, if you will. We're sort of like I call the orphan, one of the orphan departments of the town. I didn't want to say anything before, but on like, for instance, Barbara, in a historical perspective, when I first started in 1993, our secretary for the Board of Health was full-time.
Yeah.
It's got whittled down. We always had crisis. We had additions to schools. When those got all finished, they're still paying off the loans on those. We had to make plans for the public safety building. So every year edict would come out, keep your budgets down. So it was like, I keep on repeating when Dr. Faison said, how can we ever get a budget to do what you need to do? Like, for instance, communications, getting out the word out to the board, out to the town, so forth. I said, you need a crisis. That's the only way the public will act. Well, what do you mean by crisis? I said, well, you need a pandemic. Well, now we have a pandemic, but yet still there's that reluctance on the part of people to basically fund us adequately. And we're using Barbara as an example, but it was full-time when I first started.
Yeah, we did have a full-time admin person and a full-time director at one point, and it's slowly that decreased, and now it's, the pandemic hit, and we were so unprepared to manage it. And thanks to Emily and Heather, for jumping in, and we're just putting our finger in the dike right now.
Yeah, if we had communication in place, I mean, each week now, when we get our link to the Southborough Clinic and filling those appointments, takes me all this time because we don't have a system to reach the public. We have a bit of that Google form we're trying to work with, but we're just not up
Right.
and running to get our town information about this Westboro Clinic and information about getting appointments there.
Yeah. Are there any other needs that any of you see? Because this is like a once in a lifetime opportunity as far as I'm
I know.
concerned. As like, let's get the department shored up the best we can. And as an opportunity, to use consultants to help us do that. Are there any other needs that any of you see?
And you did talk about the evaluation of HIPAA and privacy
Yeah.
compliance.
Yeah, so
Yes.
the three areas are privacy and security, digitizing our paperwork and organizing in a way that, we can edit it. If you go onto some towns' health departments, you can actually access their septic plans for a specific address. And, we're not even close to doing that. So, I think, and I don't know what the best, it's obviously a consultant can help us figure that out. What's the best way to do that? And then the third piece is the communication, but then also setting a communication plan that's going to set a structure for us going forward.
Right.
And all three of those consultants, I feel like, can actually support the whole town. Whatever our new IT person learns about a privacy and security expert, it's going to help him in his work. Doing IT work for the town. Communication, if it's a website design or redesign or whatever, that's hopefully can only support him in what he's going to have to do.
So what's our next step, like, in order to?
So I think if you guys, I should have taken a motion to discuss this, but I'll make a motion to look into contracting, 3 contractors for those 3 critical areas. Nancy, do you second?
I second the motion. Yep.
Okay, so then we'll take a vote to look into contracting for, I'd like to take a vote to look into contracting for IT, privacy and security, IT digitizing our papers, and communication expert to help us with a communication plan.
And I vote yes
Okay,
on all 3 of those
great.
potential contracts.
And I vote yes also. So I think the next step is we look into how do we do that. I believe we'll
Okay.
have to go out to bid for that. And so I'll look into that and work with Heather on trying to figure out what that next steps will be.
Okay.
Heather, you were going to give us an update on COVID?
Yes. So hopefully good news, but we have, I think, leveled, at least for now, with new cases. I think I had mentioned before, we had got down to the green for 1 week for new cases. And then the week ending for April 1st and April 8th, we were in the red. The 2-week case count, if it's 25 or higher, is in the red. So we were at 26 and 27. And then last week, Thursday, the reported cases were 24 for the 2 weeks prior. So hopefully those numbers are leveling off, and we're hoping not to see a bump. Again, what we're seeing are folks 50 and under in the new cases. In the past sort of 10 days, there were 20 new cases, and only 2 of them were 60 and over. 5 of them were in 50-year-olds, but 12 of them were in 30s and under. And so that's hopefully leveling off. And as of last week, data release showed that 54% of residents had received at least 1 dose of vaccine. And I also briefly showed Taylor today our numbers for those 75 and over. is we've had a good number vaccinated, but it's still less than some of the surrounding towns. So we may outreach to some of the seniors.
And how about, Heather, can you talk about the regional clinic and how that's going? And
Yes.
and how it may be, how we have priority slots for Southborough
Yeah.
residents and businesses.
So we started last week at the regional clinic. There's 7 towns that are involved, and the allocation of vaccine is week to week. We are posting on the town website each week with the updates. But last week and this week, the clinic is Wednesday, Thursday, Friday, and we have 1,500 doses of Moderna.
Wow.
And last week was successful without any major hiccups. We administered 1,501 doses of vaccine.
Wow.
This week, the state pre-registration system filled Wednesday and Thursday, and we have private link for Southborough and the other 7 towns to fill for Friday. So we're having Vanessa post the link on the website, and I asked her to Twitter the private link. It went out to all employees of the town and department and committee members. The private link for doses this week that will be on Friday. And our town has 60 private doses, and I think about 27 were filled last I checked. So there's private dosing. There's also on what should be posted on the website soon. It describes the clinic over at Westboro Doubletree. It describes a last minute dosing call list. You can register for email and phone notifications. And at the end of the day, if we have extra doses, we can contact you.
Great.
Yeah, that's great news.
Mm.
So everybody should know there's slots available, and you don't have to be a Southborough resident. If you work in town,
Yep, any
you
Massachusetts.
are employed in town, and want to get vaccinated, please access that private link. And I've heard a lot of great feedback on the clinic, how very well it's been run, how very organized it is. People are in and out very quick. So thanks, Heather, for organizing that. It sounds like
Yeah.
it's going great.
Yeah,
thank you.
no, people are coming in. I think it's helpful that it's close by. And like I said, the state pre-registration system is linking folks with close addresses to our site. And we have Spanish and Portuguese available on site.
Excellent.
Super.
This is Tim Litt. Is this a good time for me to stick my nose in?
Hi, Tim. Yes,
Hi, Tim.
yes.
Hi, guys.
Please do.
So first off, as far as the digitization effort goes, I wanted to make sure that you're aware that the town clerk has been doing a lot of that work. I know he has some vendors lined up. He has experience. I think he may also have been trying to get some of the senior work-off people involved. So
Oh,
I'd encourage you to talk with him about what he's done. There may be opportunities, to get economies of scale, or at least understand what his experience has been. As you
Okay.
know, I strongly support that particular effort for you folks. Also, I think there's a 4th opportunity
Yeah.
or critical need for you folks. I've been having a set of conversations with people who have not been astoundingly supportive of your budget. And the recurring theme seems to be that they don't understand, and it's not clear that they believe that you understand what your needs are. And so it occurs to me that one thing you could do is get some resources to help you put together first documentation of what you know and what you need, and also to start putting together a strategic plan, a long-term plan that says, what should the department look like? How might you get there? And I know that overall is supposed to be a Heather and / board responsibility, but you're all overworked. It really does help when you're doing these kinds of things, to have someone else who's objective about it and can help. So if you have the opportunity to get someone on board with experience putting that kind of thing together, I would encourage you to include that in your considerations. I mean, for whatever it's worth, my standing offer is still open, but it never seems to go anywhere. So maybe if you spend money, you'll get further.
No, Tim, we want you to be part of that, but no, that's a great thought. And someone who has sort of the bigger picture strategic plan can help feed in all those other pieces as well, and have a clear document as to the current gaps and challenges, and have it in a document that everybody can understand is really a great idea. And maybe you can work with, if we can get somebody to do that, you can work with that person that.
Yeah.
Well, I think it's important that you do something that's polished and something that, sort of helps people avoid the current tendency to try and micromanage you,
Right.
which is what's going
Right.
on from some of the other committees. So I think you might want to add that to your, potential funds vote
Yeah.
list.
Yep.
Another thing that's come up, I keep thinking about this backstop promise that the advisory committee has, voted to offer you. And I keep getting confused. And I just thought I'd share my confusion for what it's worth. My understanding of all this is that people are saying, if something's in the budget, you can't spend CARES money on it. Okay, let's assume that's true. Well, if someone has voted to give you money, if someone else doesn't give you money, isn't that really just another name for it's in the budget under another name? So I'm not sure that approach stands up to scrutiny. And I'm a little concerned that if it gets questioned, that you may be left sort of hanging with a problem. I don't know that there's a solution, other than, going with the full budget that you wanted and then trying like heck to backfill it. But it does worry me.
Yeah, I mean, I thought about all of that as well, Tim, but when we will write, there will be a contract. Heather and Taylor will have a contract. And so that contract is a valid contract that goes through June 22nd. So.
Well, that protects them.
Right.
But it leaves the town, in a sort of peculiar place, and you as the people, who were part of the vote to put the town in that place. I wish things were different.
Yeah, no, I
Yes.
hear you, and I can honestly tell you, I'm pull my hair out all the time because, I've been trying to really work collaboratively with advisory, with selectmen, and trying to listen and come to a compromise that meets the needs of everybody. And this is where I feel like we got to, and it's with advisory recommendation that we're doing this. So I understand, and I'm not criticizing you for where you got to, but I think it's important, sort of to be on the record that this proposal has some risks, and it's not advisory that'll end up holding the bag. Right.
When people start saying, well, how is it that the Board of Health issued contracts for which there really weren't funds, except they thought there would be funds because they kind of had a promise.
Bye-bye.
It makes, if I were sitting in your shoes, I'd be nervous. And I wish I had a solution that would make everyone happy. I just don't think we can make everyone happy.
No, I know. And if our budget isn't approved, I guess tonight, the budget that's going to go into the warrant, if not approved tonight, is our full budget with the 309. So I mean, we could still be
No,
at
what goes in
town
the warrant
meeting.
is what you tell them.
What?
The budget that goes in the warrant is what you tell them. And I presume
Right.
it's what you last
Right,
voted,
it's-
this 234 number.
Right, it's what we voted and, but I'm saying if it's not, sorry,
Well, as Kathy said, it can't go up from whatever is printed.
Right.
So, I mean, today was the last chance you had to have some flexibility. I'm sorry, I don't mean to pick at a sore here, but you know, this has been going on.
yeah,
So the last concern, I'm assuming that Barbara ends up, you know, full-time with you, and that means that you write her performance review. And there's no question about that. One of my concerns with the idea of splitting it is, you know, what would a performance review look like that said, you know, she had responsibilities in the assessor's office, but didn't do them because the assessor kind of said it was okay. I wouldn't have wanted to be in that position. So should this come back, I think that's another thing you should be thinking about. And I say this
Yeah,
as someone who has managed employees.
no, agreed. And Tim, that's one of many reasons why I really feel strongly that Barbara needs to be full-time in the health
Right.
department. There's many reasons. I listed a few, but that's another one that you just talked about. And you know, just being split and those 16 hours would be out of our control, really. And say some crisis happens at the assessor's office and we would have no leg to stand on because we're only budgeted for 24 hours. And then what do we do with all the other work that needs to get done? So
Well, I think
there's
I
a
think
lot
you
of
came to the right place, but I, you know, since other people may be listening or may play this back, I wanted to make sure that that also was something that they would hear.
right,
Okay.
right.
As I said, I was going to stick my nose in and be difficult again.
No,
Hopefully you're used to me
You're
by
not
now.
difficult.
no, you
No, you've helped us a lot.
yes, you've been a great help in helping us sort of navigating this past year, and
Mhm.
it's been quite challenging at times, and we appreciate your input.
Mhm.
Oh, thanks. I do what I can. So the open thing is, do you want to either take another vote or add a vote to look at someone to help you with preparing a long-term plan and documenting requirements?
Yeah, I would like to, I'll make a motion to add another vote to our previous consultant list.
I second the motion.
And so now I want to add, make a vote to add a strategic plan that can really come up with a 5-year plan for the health department, and create a nice document that's going to support what we see as our challenges and a way to sort of meet the needs of public health in Southborough.
I vote yes to that.
And this is Mary Lou and I vote yes to that. That's a great suggestion, Tim.
Yes, thank you.
Anytime.
So, I don't know, does anybody have anything else?
No,
Your agenda had meeting schedule.
Oh, meeting schedule, yes. So we had
The
talked
next,
about having more regular meetings.
right.
We looked at having bi-weekly meetings.
Okay.
And Nancy, I don't know. I know you get your schedule like a month ahead of time. I was hoping we
Well,
could. just-
in a ideal situation, we do. It's been very tricky
Yeah.
lately. So,
So does that work for you bi-weekly?
but I can try and request, like, if I know what day we're shooting for, or even, evening.
Yeah. Heather, is there a day or time that you think might be good?
this time was tricky because we have the medical advisory team for the school.
Right.
Are you looking at mornings, afternoons, or evenings?
I think we're open to what, like, if you,
I'll just have to request that whole day off because I work 12 hours. So
Right.
it's, it's never going to be like, oh, I can get home. So I just have to request whatever day it is every other week.
Is there
And
any
just
day
what-
you always have off, Nancy?
No, I'm all over the map.
Okay.
Yeah. But it's not like I'd have to take a day off. I'd just request to not,
Work that day.
yeah, right.
What do you think, Mary Lou?
Maybe like a Tuesday or a Thursday.
Okay.
And maybe we shoot for every other Tuesday and then,
Tuesdays are a little tricky. There's a fair amount of meetings. I'm trying to think.
Okay,
Tuesday.
okay.
No, we can do, right, I think we can do 9 a.m.s on Tuesdays. It's just the afternoon, we have this other advisory that usually goes 4 to 5:30.
Okay.
But Tuesday, morning, we can do.
How would that
Okay.
work, Nancy?
So starting, let me
Like-
see, because I just got a schedule. So let me just see what I'm on. So you'd want to go 2 weeks from
2
today.
weeks Would be May 4th, would be the 2 weeks from today.
So May 4th, I'm already on. My schedule ends, that's my last week of this current schedule.
Do you have
But I
any,
can do
Thursdays
the
are
fifth.
okay. Thursdays are okay as well.
I'm actually on the
Thursday.
4th and the 6th and the 7th. So I could do the 5th. Would Wednesday the 5th work? And then we could switch to Tuesdays?
I'm,
Oh, sorry, I got
So
my
on
whole
Wed-
face in the thing.
Wednesday, I can do afternoon, but not morning.
Okay, that's fine. I'm off the complete 5th.
okay.
So on the 5th, I can do 2 p.m. or later.
Okay.
Okay, I have a standing meeting at 3 on on Wednesdays, but
Oh.
if we keep it to an hour, 2 to 3,
Okay.
which I think if we're meeting bi-weekly, we should be able to do that.
Okay.
Right.
If we
Or
feel
do
like
folks like,
a longer agenda, we could do another time.
or is like 4 o'clock good if we want to more public or right? Or when is your 3 o'clock done?
Actually, 4 o'clock might be good because then I could still pick a shift up in endoscopy and I could be home by 4.
Okay, I could do 4. I
Whereas
get
the
off at
ICU,
4.
my shifts are 12. Yeah.
Okay.
Okay.
Do you
But
wanna
on the
shoot-
5th, are we doing 2 o'clock?
No, 4.
We can do 4.
4
4 is
o'clock, okay.
good.
So if we go, let's just set up the 5th for now and let's,
Okay.
we'll think about doing every other. And if we can figure we can do every Wednesday,
Tuesday.
every other Wednesday at 4 o'clock.
Oh, okay.
You guys look at your schedules. I'll look at what I have too.
Okay.
And we can review that at our
Okay.
meeting on the 5th.
Perfect. Sounds good.
Okay.
Okay.
Is that good, Barbara?
Uh-huh.
Okay. All right, so I think we are good. Our meeting is adjourned and I will see everybody on the 5th.